So going in real quick, I just want to share my background real quick, and I'll go back to that slide, but real quick, my background. So I am a podiatrist by trade, but I started in the fitness industry. So I've been in the fitness industry for over 20 years, which means that I appreciate the lens through which you look at your clients. I carry that same lens when I look at my patients. Sometimes when we have a doctor or more the medical side, they start to lose some of the disconnect of what you guys are experiencing, the language that you need to hear things in, or the day-to-day client interactions that you have. I appreciate that. And then I try to carry what I see as a clinician and some of the more, let's say, advanced presentations in more of a clinical or a patient setting. In addition to podiatry and human movement and fitness, as Cody had said, I'm the inventor of Naboso, which I'll reference, of course, because we're talking about sensory today. I've written a book called Barefoot Strong. I'm writing another one. That book is due to come out at the end of this year, so stay tuned for that. And then I will reference the Barefoot Training Specialist certification towards the end. Now, just real quick before we jump into the slides and the topic, if you want this PowerPoint, please email me education@ebfafitness.com, or if you just want to say hello or ask any questions, you can go to that email as well. Or I have my Instagram pages, my personal one that you may follow, or EBFA's as well. Those are Instagram and Facebook. So please follow us, say hello, and ask your questions. Please, please always approach me by asking any questions that you might have. Very special thank you to Functional Aging Institute. Absolutely love working with them, done many webinars, spoken at the summit several times. So always a great thank you to them. And then, of course, Naboso is a sponsor, so you will learn more about Naboso shortly. Now, our goal, we are obviously focusing on the science of the somatosensory system. So hopefully you guys maybe came in thinking about movement, right? Because it's typically what we think of when it comes to the somatosensory cortex, somatosensory system. Somatic means movement, right? Muscles, movement. So it's the role of information coming in and motor going out. However, I want to actually go beyond that because our somatosensory system is much more than just movement, or there's actually this interrelationship of these different aspects. So when I look at brain optimization, which is a huge topic, especially as we get older, I'm thinking about EQ, IQ, MQ. So every one of my patients within myself, and what I hope with your clients, is that as they age, you are optimizing brain function, which means you are optimizing their emotional quotient, their emotional flexibility, mood. You are optimizing their IQ, or their cognitive processing, their memory recollection, right? That's going to be our memory. MQ will be the motor coordination or the movement. So mood, memory, and movement. And what's fascinating is that they're all interconnected with each other. The more that we move, your memory retention goes up. The more that you move, your mood regulation actually goes up. This is where you've probably heard that if you suffer from depression or anxiety, one of the best things that you can do is exercise, get out and move. Yes, that is from probably a simplistic way of looking at just like get the blood flowing, right? Just get out of your space and kind of move, get in the present moment of feeling your body. But there's also a very powerful sensory component to that we're going to go into. And then the same thing with memory. One thing that I used as I was going through medical school is that I had read that immediately after doing cardiovascular training or exercise, you get an increase in short-term memory retention. So I would always go to the gym, spin, or do indoor cycling, get my cerebral blood flow going, and then go home and study. And I would actually have greater focus and a longer concentration if I did that. So I actually did that partly intuitively, but also then the more that I delve into this, I was like, I was onto something. So this is really what we're looking at. Brain function is not just memory. It's not just cognitive. It's also the mood, and it's also the movement. Okay. So now brain optimization, as I said, influences mood, memory, and movement. This is based on the foundation of safety. And this is kind of an underlying theme of what I'm speaking about at this year's summit, what I spoke about in my pre-con, really where I'm going with my practice, where I'm going with everything that I look at from humanity to human movement, is that we must feel safe. Our nervous system must feel safe in order for us to optimize our sensory processing and therefore our mood, memory, and movement. So I want you to remember that, and we're going to delve into that and how we can use sensory information to feel safe. What this means is that optimal movement, optimal mood, optimal memory is really an autonomic function. So when I am saying, I feel safe, does your client feel safe? This is on a subconscious level. We are not kind of consciously in the moment aware of, do we feel safe or not safe? This is a control and the balance of our autonomic nervous system, which to remind everyone, this is kind of the balance in the seesaw between sympathetic and parasympathetic, fight or flight, rest, digest. It is a little bit more complex than that, right? But just initially, is your body in fight or flight, or your nervous system in fight or flight, or is it in a restoration social engagement state? Okay, so optimal movement, every aspect of our human being has to be in an autonomic balance or harmony and is a function of the basis of survival and safety. This is very important as we get into our older clients, especially those that have a history of falls. So let's say if you are building a fall reduction program, a movement longevity program, let's say, that's a topic I love to speak about as well. So movement longevity, fall reduction, quality of life is that you have to take in their past history of potentially emotional influences. A fall is a great example of that, or a diagnosis with a chronic disease, a diagnosis of cancer that carries a heavy emotional burden, potentially a heavy emotional burden on our clients. Now, let's say they have fallen. If your client falls and they can't get off the floor quickly or easily, and they're kind of stuck, your mind, your body goes into survival, fight or flight. They think that, what if no one comes to help me? What if I'm stuck here and I can't get myself up? That's going to throw them into a different level of fight or flight than the client who stumbles, but they have the strength and the ability to get themselves back up. So we want to appreciate that. The client might not be aware that they are stuck in survival since that last fall, which was a traumatic event. So let's please appreciate that. Okay, so survival and safety ultimately is the core of human function and humanity. We need to feel safe, and we want to use sensory processing to feel safe. So safety and survival are based on sensory perception. How well do you perceive sensory information? If your client has neuropathy, which is a topic I'm speaking about tomorrow at 11:30 a.m., they're going to have a harder time perceiving sensory, right? They have numbness in their feet. They might have numbness in their hands. What does that do to their overall autonomic sensation of safety? It's going to affect their mood. It's going to affect their movement. And will it affect their memory? It actually will. Okay. Now, we also have a baseline of interpretation to the sensory. And this is happening in the external environment and the internal environment. We're going to go into both of those. Okay. Our environment, even though we primarily think of ourselves as movement specialists, we think of the external environment. I challenge you to start thinking about internal environment as well. And it does have to do with the somatosensory cortex. So we are still staying on topic here. So how does our brain process sensory information? Here we go. So the way that we look at the brain is we can break it down into what's called a triune brain theory. Triune means three. Okay, so three primary sections of the brain. Now, the way that you can think of these different sections of the brain is they are based on evolution. First part of brain is older part of brain. You can call that the reptilian brain. So the characteristics of that part of the brain are very much based around survival. That is where you find the autonomic nervous system, your fight or flight restoration control of your autonomic nervous system and your whole being is based around a reptilian response, or a very, not primal, because that's the second part of the brain, but the oldest, the most historical part of the brain is just survival, right? Your baseline needs. The second part of the brain is where we get into the early mammalian. So this is referred to as the limbic system. And the early mammalian is now starting to have a little bit different interactions with each other, interactions with ourselves. And what that does is it starts to create an area that's based around emotion and motivation. So that's really where we find the housing of emotion and motion will be limbic system or early mammalian brain. And then finally, we go into the neocortex. This is the new part of the brain. This is the new mammalian brain. This is where we actually find the somatosensory cortex. Is where you get complex movement, but also complex cognitive processing, language, things like that. Okay, consciousness is also part of the neocortex. Okay, so this is the way that we want to break it down. Real quick, we're going to go through these. Brainstem, reptilian brain. All this part of the brain. Here we go. This is where we find it. Okay, this is where the autonomic nervous system comes out. So we want to remember that. I'm going to reference it a little bit more in a moment. This is where we get our baseline needs. So if you've ever seen the hierarchy of needs, it's a triangle, and it's essentially your baseline is, you know, food, warmth, and then you can essentially go to different needs within your social being. The highest level of needs is like spiritual consciousness, things like that. But you need to have shelter and have food before you can start thinking about consciousness. Yeah. So this is also, you can think of how it's built in the brain as well. Okay, brainstem, reptilian brain, autonomic nervous system, survival. We then go into the limbic system, the early mammalian brain. This is where you look at emotion and motivation. The limbic system can be broken down into subsections as well. We have the thalamus. Now, the big thing that you want to take away from the thalamus is this is the relay station for sensory input. Just write that down right now, and we'll go into it in a moment. So all the sensory information goes through the thalamus, except for smell. Smell actually bypasses your limbic system. Hypothalamus, this has to do with stress regulation. This is part of your HPA axis. So when you get cortisol release, basal ganglia, this is fine motor movement. So eye movement exercises, I'll be referencing that tomorrow. And then any other lecture that I give about eye movement exercises, fine motor movement can impact large gross motor movement. The amygdala, this is a heavy emotional center. And then the hippocampus is memory, okay? This is where you find the limbic system. It's in the middle of the brain. It's not the midbrain, but it's in the middle of the brain. And then finally, we go into the neocortex, or the new mammalian brain. This is where, again, as I had said, that you have complex movement. This is actually where you find the somatosensory cortex. This is where we do language, different aspects of memory as well, consciousness, the kind of self-conversation that you have with yourself is based in that neocortex. Okay, this is where you find the somatosensory cortex. So we have a sensory cortex and a motor cortex as part of that somatosensory system. You can see where that is, so right where this pink is, and then this actually would be the motor. So it's part of that neocortex. And what I want you to start thinking about to build some complexity to how you look at the somatosensory cortex is you actually have two. You have two somatosensory cortexes. The first one is the one that everyone thinks about, that we speak about a lot within the fitness industry and movement industry. The somatosensory cortex, referred to as S1, that's the one that I just highlighted. This is where you're thinking of primary somatic movement. So sensory information comes in, it's processed, and then motor output goes out. This is where we bring in sensations from touch, which is mechanoception. We'll go into that. Proprioception, which is in your joint capsules. Nociception, which is a type of a pain receptor. And then thermoceptors are temperature. Okay, it can be broken down into different areas. It's primarily broken down into what's called Brodmann's area 3-2-1, and that's the order in which you find it. We're not going into that, don't worry. Whew. If you're thinking there was an exam after this, don't worry. Okay, so that's S1. That's the way that people primarily think about the somatosensory cortex. However, I want you to start to think a little bit broader than this, that we have actually a secondary somatosensory cortex, and this is where you can find it. Now, the secondary somatosensory cortex, it still processes information that is used for motor output and brain optimization. A lot of the information that goes to the secondary somatosensory cortex has a lot to do with tactile. And being very much into barefoot science and with Naboso, this is a huge part of what we focus on. Again, a lot of tactile input goes to the secondary somatosensory cortex. But let's take it even further. We have an area in the brain. We'll look at the image to the right here. Do you see where it says insula? I know it's a little bit hard, but it says insula, insular cortex. Your insular cortex is where your brain processes emotional information. Emotional information that is based off of internal sensory information. So I'm going to be going into interoception, interoceptors. These are receptors in your gut, in your viscera that relate to your internal homeostasis. So if you feel safe because you feel in equilibrium and balanced internally, right? I don't have palpitations. I got good, not butterflies in my stomach, right? My heart's not racing. I'm not sweating, right? So all of these perceptions of my internal homeostasis are fed into the insular cortex. Now, the insular cortex is part of your limbic system, emotion and motivation. Okay, so we use internal sensory information to start to shape our emotion and our motivation. Now, what's cool is that they actually influence each other. You have a blending in of insular cortex, internal environment, emotion, with secondary somatosensory cortex, which actually is right next neighboring, connecting into your primary S1 somatosensory cortex. So if you've ever heard emotion and motion, like motion is emotion or emotion feeds motion, things like that, it is true, right? And it's deeply built within the brain. So we need to think about not just the external sensory for our clients, but the internal. And it truly is via the somatosensory cortex. It really is more the secondary, but it's still somatosensory cortex, okay? And then ultimately that will influence mood, memory, movement. All right, so let's look real quick at the different types of nerves that we have. So we have two main types of nerves. You can think of them as large and small. Sometimes people will think of it that way. Myelinated and free nerves, so no myelin. A nerves versus C fibers, so A fibers, C fibers. Now the large nerves that are myelinated are fast. Okay, so they respond quickly. That's the purpose of the myelin. So the myelin and the nodes of Ranvier, if you remember those, right, from Training 101, is that signals can go faster when it's myelinated because it essentially jumps from node to node, yeah? So this is the most important thing. If a nerve is myelinated, if it has the nodes of Ranvier, if it's A fiber, it is fast. This is primarily where you're going to see our motor nerves. So most of the nerves that we classically think of going to the somatosensory cortex are A fibers and motor, okay? But you also have C fibers. C fibers are free nerves. They don't have the myelin and the nodes of Ranvier, which means they're going to be a little bit slower, not slow, but slower, okay? I referenced this yesterday when I did a pre-con on biopsychosocial. So we have two different types of pain. You can have A fiber pain and you can have C fiber pain. Okay, now the example to help you to appreciate this is that when you have A fiber pain, which is fast, is going to be the example if you step on a tack, right? So if you step on a tack, you're going to get a really fast response because you want to trigger a withdrawal, right? That initial response is going to be via the stimulation of an A fiber nociceptor, which is a pain receptor. It's fast. Now you took your foot off of the tack, but you still feel the sensation that the tack is there, right? It's still like painful, right? But it's more kind of like dull, the sensation. It's not like, oh my God, right? That dull sensation that trails off after you have that initial stab sensation is a C fiber that's now being stimulated. Okay, so that's how a C fiber is talking to you. Your clients, if you work with a lot of pain clients, can have either A fiber pain or C fiber pain. Now, it's not going to necessarily change how you address them, but it helps you to understand their presentation a little bit more. A fiber pain, sharp, radiating, stabbing, right? They're describing, using words to describe A fiber pain. And then C fiber pain is more like dull, like toothache, right? So they kind of describe it more like this aching, diffuse, kind of hard to pinpoint, that they're describing C fiber pain. In the medical side, we actually use different medications depending on the type of pain it is. But we're also finding with Nervoso, which is the mechanoceptor, that we are actually overriding and getting people to be asymptomatic from a painful symptom when it's more C fiber. So we're kind of blocking the brain by giving it another stimulus. I'll talk more about that in a little bit. Okay, now when it comes to the S1 Somatosensory Cortex, remember this is sensory in, motor out, you have what's referred to as a somatotopic arrangement. And this is essentially the map of the person, our external person, into the somatosensory cortex or the brain. And then that representation becomes the homunculus. The homunculus is the person with everything essentially to scale. And it's showing that the parts that are the largest are the most sensory sensitive or cover the largest surface area in this somatotopic representation. Yeah, so that's essentially what you're doing. So the real estate, let's say, that your hand has in the brain is bigger than the real estate of your right butt cheek. Yeah, so that's how you can start to use that. You also want to know that if something has the largest real estate, you want to access it, right? Because then it's going to essentially light up the greatest part of the brain, okay? Hands and feet is what we're focused on. The mouth is also obviously very sensitive. Now, when it comes to the nerves of the sensory system, okay, there's different types of nerves. This is just so that we're all talking the same language, right? We want to delve into a little bit more, but we also want to speak the same language. Already we got that we have exteroception and interoception. So two things. That's step one of your new language here. Exteroception is the perception of the external environment. Interoception is the perception of our internal environment. We use exteroceptors to perceive external, interoceptors to perceive internal. The exteroceptors that we use are going to be mechanoceptors and proprioceptors, external environment, okay? And then internal will be interoceptors still, okay? Now they break down into the myelinated and the free nerve. Myelinated fast, C fiber slower, but still not slow, okay? When we look at them, your mechanoceptors and proprioceptors go into the brain or travel through the brain through a certain pathway that is different than what your free nerves go through. Okay, so when you have different brain injuries and things that are affecting different dorsal columns and lateral columns of the brain, a lot of the neuropathies, you will see that you can have disruption in one of the cortical pathways and not the other, which means that a client could potentially have still optimal mechanoception and proprioception, but they have a delay or a deficit in the free nerves or the nociceptors, thermoceptors, interoceptors, okay? And that's where patients or clients present differently, okay? You could still feel pressure, but you don't feel sharp, like a sharp sensation, but you feel pressure. Or you feel vibration, but you don't feel dull, yeah? Or hot, cold, okay? When we look at proprioceptors, these are going to be our muscle spindles and our GTOs. So we want to make sure we're using the same language here, okay? Proprioception is really joint. So I want you to think of that as joint. So when your joint moves, you are stretching fascia, soft tissue, tendons, retinaculum, right? And that is stimulating the tendons that surround a joint. And then that stimulates essentially a stretch reflex. And that stretch reflex is built around muscle spindles and GTOs. That response is actually, it's fast, but oftentimes not fast enough. So when I look at the human body and I try to reduce falls, so you're thinking of shifts in your center of gravity, right? Is your stability is directly related to your perception of a shift in that body, right? Or a joint. A joint is only as stable as fast as I can perceive a shift in that joint. So your baseline perception, I would just put that big, right? Perception, right? What is the perception of your clients? Of the sensory perception, of the stretch reflex, of the texture, of the vibration. If they're not perceiving it and you're trying to build everything around the assumption they perceive it, you're not going to get progress with these clients. So step one, perception. Okay, muscle spindle GTO. Okay, let's look at mechanoception, which is a lot of what we focus on at Naboso Technology. PowerPlate focuses on it. A lot of barefoot training, footwear, surfaces, all of that is mechanoception. Okay, so now when we look at the bottom of the foot and the palm of the hands, the skin is different, is glabrous skin. And if you've heard me say this before, kind of say it with me so that you can show yourself, because I can't hear you, show yourself that you know this, and you could be where I am in teaching this, right? Teaching people about glabrous skin and mechanoception. So glabrous skin, hairy skin. Glabrous skin is different than hairy skin. Hairy skin obviously has hair follicles. You don't have hair follicles on the palm of your hand. You don't have melanocytes. You have more sweat glands, okay? So slightly different characteristics of the skin itself. The way that your palm of your hand and bottom of your foot, it adheres to the fascia. So it's actually really tight. When you look at the fascial structure of the palm of the hand and the bottom of the foot, it's very different than hairy skin. This is partly why, just in my opinion, that using rock tape and kinesiology tape, it doesn't have as high of an effect on the bottom of the foot. You can use it on the bottom of the foot, but if K-tape stimulates the superficial fascia by lifting the skin off of the first layer of the superficial fascia and the subcutaneous layer, you can't do that on the bottom of the foot and the palm of the hand because the skin and the fascia don't react that way. Side tangent, okay? So palm of hand, bottom of foot, glabrous skin, you have different nerves, mechanoceptors. So we have 4 main mechanoceptors. These 4 mechanoceptors can be divided into 2 groups. 2 of them are slow, 2 of them are fast. The ones that are slow are continuously reading the environment. The best example of this is quiet stance. So when you stand in one place and you're just standing there, your body, your nervous system has to be reading the environment, otherwise you would fall over. Things are still engaged, right? So quiet stance, a single leg stance, standing in one place, that assessment of your clients is really important. And we lose that ability, or that ability starts to get compromised with age, even though that's potentially the most simplistic way of navigating gravity in this external environment. So static balance is really important. It's a great way that you can assess fall risk. So what you're looking at when someone stands in quiet stance is medial lateral sway. So how much I sway medial lateral, not anterior posterior. We're talking about medial lateral, okay? Medial lateral sway has a direct correlation to fall risk. So you want to make sure how much they're swaying. Okay, there's different assessment techniques that you can use. Objective, meaning technology-based. There's a company that we work with at Naboso called Body Track, and it's essentially just a force plate. It's a pressure, center of pressure detection device, yeah? And it's just measuring shifts in center of pressure, which tells you medial lateral sway or the window through which their center of gravity moves. Okay, we use slow adapting mechanoceptors to control that. Your fast adapting, these respond to a stimulation and then shut off, which means you have to be moving to use them. Yeah, so every time your foot hits the ground, you get a stimulation, it shuts off, but it gives you the information you need. So here we go. Your slow adapting one. First one, S1 Merkel disc. This is sensitive to texture, 2-point discrimination. Texture is really not texture. We call it texture, but it's 2-point discrimination. So if you look at the Naboso products, you look at Braille is another example, but the Naboso products that have pyramids across it, I'm in my office, so I have one. There's pyramids across this entire surface. Those pyramids are stimulating 2-point discrimination, not texture in the sense of I'm going to stand on AstroTurf, or I'm going to stand on like outdoor carpet. These are things that people have used, right? There's a specificity to it. Okay. Now, SA2, this is skin stretch. The way that we use this in the foot is that when you are on a rough surface, not smooth, rough surface, there's research around using textured insoles, creating a rough surface that stimulates skin stretch to the bottom of the foot, and that stimulates SA2, and that is used to maintain quiet stance, medial lateral sway, but obviously dynamic movement as well. Okay, now when it comes to FA1, FA2, fast adapting, both of these are responsive to vibration. We use vibration or interact with vibration every time your foot hits the ground. So hit the ground, ground reaction force, vibration stimulates the FA1, FA2 receptors. That stimulates your somatosensory cortex, and you are able to help maintain dynamic movement or balance during dynamic movement. Okay. Now, of the ones that go beyond just your foot and go into your fascial web is SA2, FA2. So stretch, that's kinesiology tape, and FA2, vibration. Okay, the final ones we're going to go into is interoceptors or interoception. These are sensory nerves that respond to stimulation inside the body. You can think of them as visceroceptors. They're in your gut lining, your internal organs. They connect in the fascial web, and they are telling you about your internal equilibrium or harmony. I'm not going into them too much more because of the sake of time, but if you want to learn more about them, please do check out ebfaglobal.com. We have webinars and online courses so that we go down that rabbit hole much more. All right, so here we go. So somatosensory cortex is stimulated with interoception. So I don't want you to just think of somatosensory cortex as just external environment, touch, vibration, joints moving, right? We also want to start thinking of it as my internal balance stimulates your somatosensory cortex. I showed you the brain map in the beginning, okay? Now, how do we start to piece this together? When it comes to your brain, brainstem, limbic system, neocortex, sensory information must go from one to the next to the next. It's like into the brainstem, you have to open a door, go into the limbic system through the thalamus, open a door, go to the neocortex where you find the somatosensory cortex. You can't bypass. Why this is important is that if your client doesn't feel safe and their autonomic nervous system is overriding and they're stuck in fight or flight, they get stuck in their brainstem, which means you can't go past. It's like Monopoly. You can't go past unless you go through the other way, yeah? So you have to go through the brainstem to the limbic system to the neocortex. So what happens and where you see this is that a lot of people that get stuck in survival, unfortunately, don't hear things. They don't have good memory. They have poor movement. They get a little bit clumsy. They get awkward. They get almost like a personality change. They're very kind of volatile in a sense, which means that your mood, your memory, and your movement all get optimized if you are stuck in the brainstem, which is the whole foundation of what I'm speaking about here. Yeah. Number one driver of keeps our clients in that autonomic nervous system survival is stress or trauma. Yeah. So this could be the fall that the client couldn't get off of the floor and they freaked out. literally thought that they were not going to get up, even from an unconscious or subconscious level, and then that put them into fight or flight. So we want to appreciate what's happening with that stress response with our clients. And again, or it could be the diagnosis of cancer or neuropathy or chronic disease. They just found out they have MS, whatever it is, okay? So that stress response is either a sympathetic response, which is fight or flight, or it is an upregulation of the HPA axis and a release of cortisol. Both of these are damaging to the brain. Sympathetic nervous system and being in fight or flight is damaging to the brain because it essentially shuts off and doesn't let sensory information get into the neocortex, where all of that information needs to be processed for optimal mood, memory, and movement. The HPA axis stimulation and cortisol is also damaging to the brain because the brain is very sensitive to stress hormones. We have cortisol receptors in the brain that when you get this increase in cortisol to high levels or chronic levels, it starts to become toxic to the brain. A great example of that is going to be the hippocampus. So having high cortisol is toxic to the hippocampus, and you actually get denervation of the hippocampus when you have chronic stress levels. This compromises memory. So there's research around having poor memory retention or recollection in people who have PTSD, people who have anxiety, chronic societal stress, trauma, etc. And then that's where we want to be looking at how we can help those individuals. So we need to use sensory stimulation to create safety. We want to activate the brain to optimize mood, memory, and movement. Now, some of the examples of where you can start with this, okay, of how we can bring sensory stimulation to create safety. Let's look at the 3 different pathways. You have mechanoception, proprioception, and interoception. Those are going to be the 3 main types of nerves that we can stimulate to create safety. Mechanoception, 2-point discrimination. This would be having them stand on a Naboso mat. Have them use a Naboso insoles to stimulate the nerves, glabrous nerves, touch nerves, tactile nerves that we said go not just to only Somatosensory Cortex 1, but also S2. Proprioception, joint, one of the best ways to do that is to use a weighted vest. I'm sure that you've heard that weighted blankets are something that are great for people that have anxiety or different mood disorders, or children who have sensory integration, autism, ADHD. Using weighted blankets helps to ground them. What you're doing is you're stimulating their proprioceptive system to feel safe on a subconscious level. And then interoception, the way that we can stimulate that is going to be through our breath, right? So we connect to our internal body through breath awareness, breath, different breathing techniques, right? We connect to ourselves, meditation, okay? That's just the start of it. That's just the start of how we can start to connect to sensory information to optimize mood, memory, movement. Yeah. So let's take this real quick. Someone is anxious. A child is anxious. Your client is anxious. You're feeling stressed out, right? You want to get grounded. Bring in sensory information. Get your shoes off. Get on a mat. We have children that will use our mats and our material in schools. That when the kids get a little bit excited, we ground them with texture. That regulates their mood. They're starting to get anxious and worked up, and then it also increases their focus. So now we have the memory side of things. And then from the movement, of course, you are seeing better foot awareness, ground awareness, placement, balance, etc. Okay, so let's go a little bit closer. I know that we're pulling towards the end here, so let's start wrapping this up. So let's look just a little bit closer at these 3, and then we'll see if we have some time for questions. EQ is going to be mood, right? Your mood, emotional flexibility. We need to be emotionally flexible, No, I wasn't going to say with age, but just in general, we need to be emotionally flexible. Emotional flexibility typically goes down. So it goes down with age. So we become, that's where people say like, oh, they just kind of, as they get older, they're crotchety, right? They get kind of stubborn in their ways. Some of that has to do with changes that we're going to go into, changes of vagal tone, heart rate variability, that is kind of like not their fault. It's deeper within the nervous system of why that's happening. You also will start to see different personality changes with chronic diseases. I just did a webinar on the blood-brain barrier and how brain inflammation is critical or deeply related to gut inflammation. So it was kind of a gut-brain connection. But a lot of chronic neurological conditions such as MS and Parkinson's and things like that have chronic brain inflammation that actually leads to changes in personality. And it's inflammatory related, but it's also emotional flexibility related. Okay, so being emotionally flexible means that you're not reacting, you are anticipating the environment. You aren't reactive, you're anticipating. Okay, now vagal tone and emotional regulation. Someone who has high vagal tone has classically high emotional flexibility. So it is the Richter scale that we want to use to navigate or objectively navigate our emotions, okay? Another term for vagal tone is heart rate variability. Heart rate variability, they're synonymous. So in your notes, I would say vagal tone equals heart rate variability. Vagal means vagus, vagus nerve is the autonomic nervous system. And the part of the autonomic nervous system it is the parasympathetic. So when someone's vagal tone goes up, the strength of their parasympathetic muscle or the reactivity of the parasympathetic muscle goes up. Okay, so we want to have high vagal tone, high heart rate variability. Okay, your vagus nerve controls heart rate. Okay, so heart rate variability, you're essentially measuring this interbeat interval. It's driven by the parasympathetic system that I had said because it's actually faster. The higher the HRV, the more emotionally flexible. You can measure your client's heart rate variability with any of this smart technology that's out there. There's an Oura Ring, heart rate monitors that connect to an app. So there's lots of things that you can do, and they're becoming more and more affordable. The Oura Ring, I think, is around $300. So it just depends on the investment the client wants to make. But I would say from like a total transformation assessment you want with your clients, I would want that data. Okay, so now there's a link between prefrontal cortex and heart rate variability. When your heart rate variability is low, you actually disconnect the prefrontal cortex from the way that you process emotions. It's taken offline. You then become driven solely by your amygdala. Okay, the amygdala is just all emotional. This is someone who's very reactive. So when someone's in an amygdala state, you know that they have low heart rate variability, low vagal tone, their system feels not safe. How can we bring safety to this person? By bringing in sensory information, both interoceptively and exteroceptively, okay? It's essentially what we want to do. Memory, next one, IQ, memory, okay? What's the correlation here, right? When we're stressed, when we're in a survival state, your limbic system or the hippocampus part of the limbic system starts to denervate, okay? There's correlations of compromised memory and chronic stress, PTSD, panic attacks, or panic disorders, anxiety, etc. So we want to think also, could the memory side of things be that my client doesn't feel safe? Now, another thing that we want to do is to make sure for optimal memory that the brain is turned on in the first place. We need to turn the brain on. How do we turn the brain on? Guess what? You can use touch. So we want to stimulate a part of the brain called the reticular activating system. Your RAS sits in your brainstem. Your RAS sits in your brainstem, and this is what turns your brain on. It's the ignition to your brain. Okay, It is referred to what's called cholinergic. Cholinergic means just brain awakening, okay? There's different things that are brain awakening. Touch is brain awakening. So you want to wake up the nervous system. I use this and recommend trainers and coaches use this with their clients by barefoot activation before the session. Touch things. It's not just what we touch, it's us being touched. So if your client foam rolls their body, they're stimulating sensory information to turn on the brain so that they're either ready to learn, ready to move, or improve their mood. Yeah, use this in all different ways, please. Another way that you can do it is by dry brushing. So dry brushing, which is used for lymphatic stimulation, is also a form of sensory stimulation to the hairy skin. Okay, great way to kind of turn on the brain. I tell patients to do this in the beginning of the day because it turns everything on. Brain is ready to go. Okay. Another way that you can stimulate the RAS to turn on the brain is going to be through your eyes and your ears. So your eyes and your ears are connected to your reticular activating system. This is where you could do eye movement exercises, is a great way. Or you can stimulate the vestibular system by doing vestibular exercises. You stimulate the vestibular system because it connects to your tongue ligaments. You can bring your tongue to your palate. You can yawn if you want. Rubbing outside your ear here will stimulate your reticular activating system. So that's essentially turning on the brain. Once your RAS is on or your brain is stimulated, then your brain is ready to learn and move. So let's just look real quick at the importance of sensory stimulation if someone has dementia. So there are sensory rooms that are used for people with dementia. You may have heard of these. Why I mention it is because I just want to hit home that it's something that is used for those that have compromised memory. Now, people who have compromised memory also oftentimes have poor emotional regulation, which means that they get frustrated very easy. They get annoyed, impatient, things like that. So their interpersonal relationships, when someone is going through dementia, starts to get compromised. And that's just to hit home that mood, memory, and movement are all deeply linked. One starts to go, oftentimes the others get compromised. Okay, last part that we're going to go as we wrap into these last 5 minutes, and then maybe I'll have time for some questions, is movement or MQ. Key foundation concept here is that sensory input drives motor output. Sensory in optimizes motor out. If you want better movement or motor out, you want to upregulate all the sensory information. You now know how to do that. Get the mechanoceptor stimulated, get the proprioceptor stimulated, get the interoceptor stimulated, because all of that interconnects through the somatosensory cortex, and you will improve movement. I already mentioned the importance of impact forces, which are vibrations. Vibration stimulates your feet, but it also stimulates your entire fascial system. All of the cells in the human body vibrate. So one of the most important sensory stimulations in the body for life and longevity and vitality is vibration. Okay. Gravity is another huge force that is really important. So I know Cody and Dan, whenever I speak to them, they say a big part of their belief is that getting clients standing up. Get clients vertical and fully weight bearing versus doing all these chair exercises. Because once you're in gravity, you start to get all of the sensory stimulation from that gravitational field. The proprioceptors, the mechanoceptors, the inner ear, everything starts to light up. So highly encouraged to stand up as well. Last few things is for movement, power plate, whole body vibration, Naboso, 2-point discrimination mat, rad roller or some sort of trigger point release, getting that proprioceptive or trigger point release to the bottom of the foot or to the whole body. Now, just to hit this home real quick with Naboso. So I believe that all brain training or neuroplasticity training should be performed in a sensory rich environment, which means they should be barefoot. They better be barefoot, please. Coming after you. Please make sure they are barefoot. Hold something in the hand. Have something that's vibrating. We have a new tool, secret one here, new tool that's coming out for the hand to stimulate the hand with texture. To hit it home, Clark et al. Found that wearing textured insoles can reduce prefrontal cortical activity during walking in those that have somatosensory deficits. What this means is it was helping to keep movement subconscious. Subconscious is where you want our movements. And then we focus on other aspects. Some other things that you can use for walking is walking poles, urban poling, SMOVIs, which are weighted systems that you can have in the hand and then it vibrates. Neboso, whole body vibration. Hypersphere is a ball that vibrates. And then here's just a real quick recap of those somatosensory stimulation to improve mood, memory, movement. Proprioception, get them in a weighted vest, get them upright in gravity. Get them using wrist weights. So that's one of the best things that you can do for people with movement disorders and help ground them in gravity is to use something, wrist and ankle weights. They make super cute ones now that look like bracelets, not like old school ones that probably we had or our parents had. Being in water, so being in the pool. Pool work feeds the proprioceptive system and helps to build safety to their autonomic nervous system, unless if they have a fear of drowning, but to feed them because they connect. It's used with children with cerebral palsy and sensory integration a lot. Mechanoception, get on a Neboso mat, get them barefoot, get on a power plate, trigger point, release the feet. Use kinesiology tape. Interoception, do breath work, breath awareness, meditation, heartbeat tracking, have them just sense and count their heartbeats. So it's a way that you can start to tie in all of the sensory nervous stimulation, not just thinking touch or proprioception. Okay, so as you start thinking of maybe some questions, we'll maybe, you know, ask Cody nicely if we can go through a couple of questions, we'll see. But I do want to make sure I'm bringing to awareness that we have 25% off all of Neboso products through the end of June. This includes all of our mats and our insoles. This is the code FAS 2020. Head to our website, nebosotechnology.com. Again, if you wanted this PowerPoint, email me education@ebfafitness.com. And then we are super excited to have our BTS level 1 certification through FAI. Yes, we're super excited. So make sure you sign up for that through their website. They will be sending an email out to everyone. There is a code to get a discount. Look for that in your email. And that is it.
Awesome. Well, thank you once again, Dr. Emily, for delivering such great content. And for those of you that were new to Emily, I warned you, right? It's going to go deep. It's going to get serious. So put your thinking caps on. So if you've got some questions for Emily related to this session specifically, please go ahead and put those into the chat box. Remember, you can get these PowerPoint slides by emailing her education@ebfafitness.com. So make sure you write that down. It's also in our little chat. If you scroll through that, you'll see that I posted that as well. So make sure you get that. So one of the questions that we got was just kind of going back to the use of the kind of vibration training. And so can you kind of talk about that just a little bit about like how would you use that? I know in your networking session, you're going to go into more about your Neboso technology, but from a vibration plate perspective, how do you recommend using that to kind of get the most out of it?
Yeah, so in my office, I have a power plate, and I like power plates vibration platforms. There are other ones that are out in the industry, but just whole body vibration in general is several ways that I use it. I like to use it as neuroactivating. Some people like to use it as a massage or to inhibit and increase mobility, which you can. I use it primarily as neuroactivation. So it would be the start of, let's say, a session, or I'd want them to do it in the morning. They can simply sit and put their feet on it. Depending on how they respond to it, they could go all the way up and stand on the plate, be in an isometric contraction and just hold it there. When you look at the dose of whole body vibration, it's lower. So you only need about 10 minutes of whole body vibration. Most of the research is around 30 hertz high amplitude. So make sure that the client is fine with the high amplitude. Small doses, definitely better. And then some great effects for it is it increases arterial circulation. So you start to get this vasodilation. You decrease arterial resistance, which means you get better blood flow. You get better cutaneous circulation, so to the skin, which is great, especially for people with neuropathy. You get stimulation of osteoblasts, which build bone. You increase insulin-like growth factor, which is a growth hormone for bone and tendons. So to me, it's a form of neuroactivation and regenerative medicine. We'll loosely use that term.
Mm-hmm. Okay. And I've got a question for you because it's just, I think something that's interesting to me, and talking about kind of the individuals that are at risk of falling, you know, those that are a little bit more frail, a little bit more fragile. There's so much to work on, you know. I mean, they've got so many things that are going on. It's sometimes difficult to train them because you kind of get lost in the woods a little bit. You know, there's just so many things, you're trying to fit so much in. So with those sorts of individuals, from your perspective and from your experience, so, you know, a trainer working with a client, and it could be even in a small group setting, you know, when you've got multiple clients that you're working with, what's your recommendation for where to start with all of this? You know, like if you said out of all this content and this approach, kind of what would be the thing that you started with them? Because you're, you know, again, you're dealing with strength issues and other issues that you're having to train them on. What are your suggestions there?
Yeah, that's an awesome question. So I learned a lot about this firsthand when we were doing a Naboso pilot in an active or an assisted living center, and we were using them to see if we could reduce falls and improve balance. And a lot of them were exactly what you're saying, super complex, where you're just like, I don't even know where to start. What I would say is to start with establish body awareness. Yes, you have strength and all of these things, but just what is your baseline of establishing body awareness? Their orientation to themselves in space. And that goes back to internal and external. So are they connected to themselves? Do they know where their arm is in space? Do they know where, you know, their foot is? Can they perceive the ground? And then you start almost with that baseline versus, well, let's just get quad strength and glute strength and bicep strength so they can get out of a chair and things like that. But then they stand up, and as soon as they get a subtle shift in their center of gravity, they overcorrect, and that's where these falls are happening. Because it's really like an all or none, or like an oh shit reaction that is just grandiose or much larger than what they need. And that has to do with the decrease in subtle body awareness with age, or with aging of the nervous system. So that, honestly, that's where I would go right back to my last slide of these recommendations would be this. Like, what can you do to just improve their body awareness? Put some weights on them, you know, get them to have some insoles in their shoes, have them to just stimulate their feet, incorporate the vibration training. You can, a lot of the vibration rollers you can now use all over the body, where maybe they don't know what their shoulder feels like anymore because of their age. Stimulate it vibrationally or with K-tape, and you build that connection back with them. That's how I would start.
Yeah, that's really good. I really appreciate that. Well, we've got some more questions coming in, but you've got networking time that's coming up right now. So I want to just thank you for your session that you put out, and look forward to kind of interacting with you more and learning more from you, and definitely excited to have your certification through FAI.
Thank you so much. It really was